Hello everyone, welcome to DHN CXO podcast. Today we have two powerhouses of healthcare technology with us on the podcast episode. Mr. Sumit Singh, Chief Technology Officer at Wockhardt Hospital, and Mr. Unmesh Deshpande, Head of Information Technology at Wockhardt Hospital. Both of them have recently taken over the leadership of healthcare technology at Wockhardt. So congratulations to both of you first and welcome to DHN podcast episode.
Thank you.
All right, let's first start with the most obvious, with the most crucial question. You have both seen healthcare technology evolve over the past 3 decades. If I may ask both of you, what would you say was the most important thing that you have seen shift in the last 3 decades when it comes to the role of healthcare technology leader? Has it been that earlier this role was considered to be just a utility manager and now it has moved to a strategic innovator, or what do you say in this role that has shifted? Any one of you can go first.
If I say earlier days of healthcare, maybe 15, 20, 30 years ago, the primary role or responsibility of IT was to ensure, the printer works, the billing system works, it's not frozen and so on. And so mostly we were, basement dwellers. Most of us maybe still be there because of that. But in any case, today it's vastly different. We are in the boardroom. We are making, decisions with regards to AI, maybe IoT, cloud adoption, so on and so forth, all in the pursuit of actually, providing better care to our patients primarily, and obviously, the entire ecosystem behind it, the clinicians, the nursing team, the staff and so on. So it's vastly different. We, are now, innovators rather than just, back-end managers, I feel. And we can grow the business now rather than just keep it running.
I would like to add to the perspective which Sumit has said. The term that he used, that it has traveled from the corridors of hospital to the boardroom. So that shows people have started adopting and respecting IT.
Okay.
So if I have to give an analogy on a slightly lighter note, you imagine the small bioscope machines in rural fare where you peep through a box and something happens, right?
Correct.
You can imagine but not feel. To a 3D movie where you wear goggle and you feel that that particular sword is coming to you. So this transition of what has happened into entertainment world has happened in healthcare as well. Earlier, computers were used only to store records, just because they didn't want to do it on paper.
Correct.
Those records in Excel file or FoxPro database or whatever were actually meant for making a report and printing. There were no clinical usages of that. But then from that black and white era, it has come to Eastman color, with AI agents talking and doing data mining and presenting you analytics, presenting you guidance, guiding your business to a more patient-centric with technology which has a human feeling as well. So this transition journey, we are fortunate to really witness and be a part of it.
We had to talk about what happened during the early days. I believe at that point of time, one of the major challenge, Unmesh, was getting the network to work, right?
Right.
Now, as we shift towards a better or a modern approach, now we have seen that there has been a transformation in how the IT functions in hospitals. And as you rightly mentioned, from the, I would say, basement to the boardroom, that has been the transition. But still, there are some challenges from those days that persist today. What would these challenges be?
It can be answered in a singular word, like wow. Are we a part of that journey? Did we really do it? But such statement come from people who get surprised by the change. But at our level and our experience, we make the change happen. So if we are change maker, we know what we are doing. and we know what was not done when we expected the change to happen. So in past 30 years, data was created, getting stored, but it was in silo. All these data silos were not connected. Nobody had an effort or an idea how to connect them. Unless all the segmental data uh, got connected, no meaningful outcomes were there. Today, we are talking about predictive medicine, clinical decision support system, and all these things. Why we are even thinking and talking about? Because we have got a unified data. All the systems within a healthcare establishment, be it electronic medical records or inpatient records or your PACS, LIS or billing, revenue or any other clinical databases, they interface with each other, they talk to each other and they sing the same tune. That is more important. And that music actually results in having a better decision for clinical. So faster decision taken, life saved. That's a technology touch point to save human mankind. So that's a connect what I see, what has happened in past 30 years.
Absolutely. I mean, just capturing the data is not enough. Making that data work for the patient should be the end goal, I believe.
Right.
Mr. Singh, you might have anything to add to that?
In the last 30 years, of course, I would just simply say, if there was a Rip Van Winkle, something like that, they wake up and see, they will not be able to identify it. I mean, things have changed so much. And with that, obviously, expectations are also very different. And, I think we need to innovate. That's all it is all about. And this transition didn't happen overnight. Obviously, it was an incremental change and it will continue. So then, this question can be asked again 30 years from now or some time from now, and probably the answer would be in an essence the same thing. We rest, at the innovators' shoulders who did before us. And we hope to leave the same legacy, and that somebody will take it forward, and so I think he's answered it quite well.
Sumit, if I may ask you a question adding on to that. In terms of IT culture and governance, what did you inherit and what did you see the systems that you had to maintain and what needed like a complete shift or a innovation?
Yeah, yes. Firstly, this is in some sense kind of second innings for me over here. In fact, as a yeah, absolutely homecoming. But even the homecoming didn't start very recently. I was already engaged in a very small way, doing something I think was quite significant, and it just worked out in that manner. But more, it has come to me recently with the realization and everything else. I think the IT culture, that I have inherited, which I'm trying to change, is basically, if it's not broken, what's there to fix? It was more thinking of that kind of a mindset, but that will not lead to much improvement. The culture was, in that manner, the governance. I think what we need to do is vastly different, in the sense that, okay, have a kind of a broader vision of what it is going on. Look at the ecosystem and find ways to improve it. The whole thing is that the technology should be kind of, in some sense, first of all, not in the way. Secondly, it should be kind of invisible, so that actual work happens, and you go on. So I think what is the biggest challenge. I think people need to collaborate far more. We need to listen to people what's wrong and not just be reactive. And that's kind of change that I want to drive as such.
Interesting. I recently came across this conversation about there being two types of technology, one being a transformative technology and one being an efficient technology. So basically, efficient technology is something that makes a workflow that already exists more efficient.
Right.
And transformative technology is one that completely reimagines an entire process, maybe go to the root cause of it. I found that conversation very interesting. So, and since today we are meeting, I had to ask you this question.
Okay.
From your point of view, what do you think whenever you look at hospital processes? I know a lot of doctors also complain that, okay, this technology you have, sort of forced upon us, and the change management then becomes a hurdle in adoption of that technology. From your perspective, How do you see the use of efficient technology versus the transformative technology in the healthcare context?
See, the choice of choosing between both of them is not very obvious. It is very objective, and it is very relative to the establishment trying to adopt it. Because even if you have to adopt any one of them, you need to be ready for that. How do you get ready for that? So, technology alone can't do anything, right? There has to be intent. For that intent to be supported effectively, you need to follow one principle which I have been following: do the right things and do the things right. So, one is a strategy platform, another is a driving platform. When this strategy and driving platform merge together, you're ready for transformation. Because then there is nothing on the technology side and business decision side that can stop you from doing that. I feel that we should not go into transformation just because everyone is going. You have to do introspection whether your organization needs a transformation, because transformation needs budget. Budget means finance, right? So finally, technocrats or leaders, whatever you call us, we are always dependent on capex and opex and ROI and TCO, right? Our technical skills and vision or passions, they revolve around them and they're bracketed. So we need to make best use of this and take a well thought, well researched decision, and take a note to the leadership team of any organization that we are working for, whether they want to go for a transformation. If yes, then how, and plan the project. That is how it is.
Absolutely. Mr. Singh, coming to you, I want to touch upon the security part of it. I mean, 2024 has been a year which highlighted how important cybersecurity is from the healthcare perspective. We have seen the worst of, cyber attacks on some of the biggest health systems across the world. From your point of view, considering that you also have to make sure that there is a frictionless access to the clinicians, to the paramedics, whoever is using the technology within the healthcare organization, and versus maintaining a security, how do you see that balance happening?
Way back when, probably when I started my career, okay, if there's an antivirus, if there's a firewall, probably, my boss would have slept well, because that time I didn't have that responsibility much. But 30 years ago, they could have slept well. But that is grossly insufficient. Today, we have to worry about, every device, every click, every person also, because these are all, points maybe that could cause failures meaning breaches and problems, right? And, we live in such a connected world that, it's just not a financial risk that can be just, it's a reputational risk. We'll know a lot more. If I were to put it in some few words, how we should go about it, it obviously, one of the things is identity management. If we could do a single sign-on with identity management, it'd be a good thing. Data. He talked about, silos. I'm not talking about silos, but containerization of data in some sense. And then, with proper, what do you call that, oversight in some sense, basically the sign-on part I told you, identification management I told you, I think you can pursue basically the objective that you mentioned, providing the right data sets, to the right people. There could be clinician, there could be nursing team, there could be the staff, whatever it is, but you have to. And, I think you touched upon trust in some sense, okay? I mean, if you have an inclusive process and if you are a proper, custodian of the data, so to speak, right? Trust, will build over time. It has to be basically, a two-way street. Mostly we need to provide what they need to provide in the right and most efficient manner, not come in the way in case of whether it is emergency or whatnot, that we do not have these things. But trust will have to be earned with basically, ease of use, as well as what is to be used as well. These are the two things that I think are the way to pursue, I think, the current, the threat landscape that we face as such.
And I think recently I also heard an example where hackers, entered the system through the admin login of a particular hospital, and then they access the security cameras of gynac wards. And that's a very huge threat considering that. Would you have any comments or any add-on to that?
How did that password leak? That is where investigation is required. See, I've started to believe one thing. You put $1 million in your hospital security, cyber security and data protection, everything. But finally, what is the loosest and weakest chain in this security? Is a human being. There has to be one single person at a location who has got admin rights on the system. What if his integrity gets compromised and he leaks out the word? You're gone. So you have to do a double investment into cybersecurity or data privacy and things like that. Number one, obviously the tech stack is there, which is proportional to the security that you need or want or expect. Then you have to build in the culture within the employees. You have to build their integrity towards their job. If both these tracks are running in parallel, at least you have covered two bases. You have to make sure that sometime or somewhere or the other, these two tracks, rather than running parallel, they intersect. And both put together will form a formidable team which cannot be broken. So finally, there can be a million solution to secure your perimeter of your network and data by adding a lot of technologies, like you go in for firewalls, you go in for AI based software which actively defends, not only tells you what has happened, but it prevents, it does prediction and all these things. That they're all good to have, but what you must have is the people's integrity. And we carry, as a technology people, we carry huge responsibility of managing the technical front, but equivalent, the HR, whosoever is HR head or that, they carry equal responsibility of building that ownership between the employees and the integrity which will support our technologies.
Absolutely.
Purely technology cannot do anything.
As they say, I mean, your security is as strong as your weakest link. And as you rightly mentioned, humans are the weakest link in this entire process. So that culture of being accountable to that security of your organization has to also sort of be built within the employees of that.
There was a movie of Spider-Man, and when Spider-Man gets all the powers from his grandfather,
Yes.
he says, "Grandson, with power, it comes responsibility. Use it wisely."
Very, very.
That is what it is. That is what it is.
And you should let me talk about movies, I know better. But anyway, I mean, actually, we are too much in love with plug and play. We forget that, it's not just plug and play. It's good to see it just started working, right? But then there is more to it. And that incident was a complete failure of human. Like I said, there are three things, maybe the device, maybe the, the clicks or whatever, and maybe the person. It was total person failure, whether it was a cause of, we don't know all the background, but definitely the device is not at fault. Admin 1, 2, 3, 4, whatever that password was, it is what it is to get started. Now you got to take care of it beyond that. And you did take care of it, whether it was laziness, whether it was lack of education, whether it was integrity, too much pressure. One less drop before the camel broke its back, right? Maybe that, who knows what it is. But the device is not culpable. And it was his uncle. And with great powers come great responsibility. That's the exact quote. Or let me be better. Okay.
Unmesh, coming to you for the next questions. I mean, it's a constant battle between, brilliant clinical ideas and the practical implementation. How do you, as head of information technology, manage that innovation pipeline? How do you sort of, identify, pilot, deploy, and scale the technologies that you have in the hospital?
See, innovation are endless. The innovation at workplace, if you are having a creative mind or a creative team who is really propelled to do something different than just fixing up issues with the computer or technology or whatever it is. So if you have that kind of a team, what do? We really find out the areas where actually innovation is required. So you branch out certain project or initiatives, work on it, and when you have achieved the confidence that we can promote this within the organization, do a sandbox pilot and have a recursive load test, case scenarios, testing, and everything. Make sure that it works. Never experiment innovations on a live platform, because live platform is your bread.
Correct.
Working software is your butter. Innovation can add cream to it, but that cream has to be properly tested before. So do sandboxing, do entire analysis of the solution, innovative solution that you're deploying. Who are the people who are going to be benefited? What is the cost involved into deploying or rolling out this innovation in a production environment? Does that expenditure justify? Because when you innovate and put a system, it ought to save something, right?
Correct.
Either time, so in turn money, or it has to generate some precision results which will elevate the brand equity of the establishment, and patient outcomes will be improved. So all these of deploying an innovative solution, they have to be first evaluated.
Well,
Once you have got all this picture clear and you can see success on your horizon, then and then only promote this to your management. If you do promote this without this exercise and approach somebody prematurely, then that particular innovation department is out for disaster. So there has to be a set of people who will wear black hat. There's a book called Six Thinking Hats by Edward Bono. So you wear a black hat, which is a negative hat. You wear that and see that, always make a statement. You have created this solution, this is going to fail. It does not have this, it fails over here. So there has to be a critic, and it has to be superbly criticized. Then all the shortfalls will come. And once you have done all this process, whatever you deploy will definitely has a highest chance of being successful on a production. And that is how one has to manage innovation.
That's wonderful suggestion to all the healthcare IT leaders out there, because they always question like, how do we approach the management that we need these kind of technologies in our hospitals? What should be the approach? I think this pretty much answers that question.
At the same time, we must understand the difference between invention and innovation. You do something and you say that this is my innovation. The difference is a hairline. Invention is what you have created which was not there before. Adding a commercial value to that invention transforms it into innovation.
Sumit, coming to you, I mean, hospital systems are notorious for alert fatigue, but you also have to balance the digital transformation within the hospital while also ensuring that physicians don't burn out. How do you balance this both?
It's a very good question. Pace and rate of technology has meant, putting a lot of things in front of the clinicians. Sometimes it has been referred as death by 1,000 clicks. Sometimes, what you are saying, burnout and fatigue, all of that, right? We have to ensure that, they get to spend more time with patients and then, than actually in front of the screens. It's a tough thing. What we would like to do, and I'm not going to say that everything is done and dusted and all successful. Whatever we bring into the system in front of clinicians, and in fact, the entire hospital is quite stressed out in some sense. The nursing team is also like that. Support staff is also quite burnout. But anyway, we need to assess what we bring through the burnout filter. Are we doing and putting things for the sake of technology, or what? Is it helping? And how is it helping? And so on. So, if you put that burnout filter thought set in your mind, then probably you will be more thoughtful in what you choose and what you pick and what you place, so to speak, right? And then the solutions will kind of be chosen and brought to the fore from that perspective only. There's no going backwards. It needs to be basically thoughtful in what you put it in front of them, whether it is having meaningful positive outcome and so on. Okay. Obviously, I also would like to add one more line. It's not all about technology or the tech department's responsibility alone. What the workload is, and so on, it needs to be a holistic view should be taken by the entire management, so to speak. Okay, it's not just simply what because of us they are burning out. Today, new technologies have come in, voice-based, and there are those that are not very, pervasive in their ways. They can be, quite, yeah, they are, yeah, they work, in silence, beside you, and they can transcribe a lot of things quite accurately. And so then, maybe, your screen time is reduced. And so these type of new things that are coming into the market, so to speak, okay, needs to be looked at. And, I'll just simply say that all people involved in this process should be having this burnout filter kind of thinking in their mind, and take it from there.
Right.
Yeah.
Unmesh, I think you seem to agree with what Mr. Sumit is saying.
Yeah, fully agree. I mean, we are so much in sync.
Okay, but you can't be short of words.
I am not short of word. I was fortunate enough to be a part of a design team for an entire hospital, a totally greenfield. So when I joined that organization, the RCC structure was up, and we were designing the interiors, where the nursing desk will be, on which floor and whatnot, all these things. So that time I had proposed to the architect and the management that, boss, our building, that particular building, is a long building.
Right.
And they had nursing desk on both the corners. I had some stats with me from some hospital or something. So I was able to tell that if there are 5 nurses for some 35-40 beds, and assuming that patient requests nursing support for, let's say, 8 or 10 times in 24 hours, which is quite okay, right? You calculate the distance that the nurse has to walk in her shift, and it was about 8.5 to 9 kilometer average. You don't realize, because it's like paying in EMI. You don't realize, but it happens.
True.
So that really makes a physical burnout for the nursing staff. That reflects upon improper recording of EHR on the floor, and that, it's a cascade. So this is all connected. I mean, ergonomics of business is far more important than what technology you adopt.
Yeah.
There are so many vendors, so many flavors. I mean, if you name all the technology providers who are providing various services for healthcare, it's like going to a big ice cream parlor with you getting confused what to taste. And finally, you end up tasting each spoon and still are not decided. So when you are in confusion, how do you start that? How do you start the process? You have to delink yourself from this confusion. It takes a lot of strong willpower and mindset. But if you have been interested to decide a technology platform and whatever, you have to delink and then take the decision which is appropriate and which will cut down all the system burnout. Even the computers, they do get tired, because if a software is not properly engineered, there's so many temporary files getting created on desktops. The desktop fails after some time. Blackouts are fine. They are easily noticeable. But brownouts, they slowly start progressing. So you don't realize unless they are too hot.
Let's move on to the next question. I think 2 letters that have dominated the entire 2024 and 2025 now is artificial intelligence, AI. When you look at artificial intelligence in your hospital now, what are the priorities for you? Is it the infrastructure or is it the ethical or regulatory, conditions?
I think, one would like to say it is infrastructure, but it is not. You know, the governance of AI is extremely important. You know, you need to basically understand, AI may come with its own biases. It has to have this explainability factor also. A lot of data that it sits on. Okay, right? So even the infrastructure by itself does not work alone without if it is not prepped correctly. So to me, I think the most important thing is the governance of AI, frankly speaking, then the engineering part of AI in some sense. The engineering part probably you can handle it better, but this is a new field that people are all of us are learning in some sense, and some people are thinking lack of control, some people are thinking lack of privacy, invasive in some sense. Others are thinking, will it basically take my job, maybe do better. So many concerns are there, right? How you have to build that trust, that you can basically and some people have already said instead of artificial it should be assisted. You cannot take the human out of this entire equation anyway, so you please assist it in better decision making, whatever it is. So to me, it is a bigger governance challenge than an engineering challenge. Okay, and even in the engineering stuff, if your foundational elements are not right, then the best of AIs will not give you anything meaningful anyway. That's how I see this AI basically getting more traction in healthcare or elsewhere also. That's what I think.
Whether we, like the onset of AI in any industries or not, AI is definitely here to stay. And that is also shifting how people are reskilling themselves or how they are, being familiar with the new way of doing work. As a head of ID, uh, what do you think are the new technical competencies that IT leaders should learn, especially with the onset of AI, or maybe some existing skills that need to be prioritized?
Oh my God, this is a question that needs to be answered by CHRO or people officer, CPO.
Yeah, and good it is being answered by you also.
Yeah.
Not me. I want to hear it also.
So this is a very tricky and a complex question to be answered. But having said that, what I personally feel is human being as an entity is a fully configurable system. If you are leading a technical team or some a group, you obviously have people who have been there with you in your tough times, good times, bad times, whatever, and they've seen things happening and they've seen things failing also. Since they have seen things fail, there is a lot of skill development that they would have already done so that the things doesn't happen again. So I think my first bet would be whatever staff you have right now under your team or leadership, you try and understand their technical hunger or appetite. You see whether you can reconfigure their minds, approach, attitudes towards scaling up new heights in, for example, AI. Train them. There are so many online courses available that they can attend those courses after going home. Maybe organization can even look at sponsoring those courses. They're not very expensive, but at least foundation will be laid. With that foundation, their mindset will be programmed. With that mindset, they will have an internal feeling of taking on these challenges head on.
Right.
And that is how it should work, I think. HR should have a larger focus on upskilling their existing employee. They've been there and they've been running your organization. So you upscale, you invest in an employee. So there is a common talk between a CEO and CFO. CFO says that we must invest in our people's training. CEO says we train and they'll go off. CFO says, what if we don't train them and then they stay in? That's how it's. Yeah, this is very dangerous. It's a permanent cost structure in your organization. So upskilling, organizational driven or personal driven is absolutely mandatory.
So, Mitchi, building on to what Unmesh just said, based on this, what would your advice be for the next gen healthcare leaders? And sort of a corollary to that, what would be one non-technical skill that is essential according to you in this role?
Answer will be the same. I mean, in the sense that when I came in, I already said that I think I would have expected that the fires that I need to be putting off would be primarily in the infrastructure and cybersecurity related areas. Yeah, surely, but that's not the biggest challenge. And I think what I needed to do, I do, is to listen and spend more time with different parts of the organization. What are they facing, what are they doing, spend time with clinicians, nurses, staff, what's happening there, and so on. So if I have to tell somebody coming in with this, okay, get your communication skills up very high. Learn to basically tell your technology story actually well. If you are able to do that, basically also answer why, and the how will come because of the technology. Very simple. So, but for that you have to be a very good communicator, whether you are an exceptional leader or you're just managing and stuff like that. So
Technology touching human mind, interfacing with advent of IoTs, wearables, and things. So I mean, I don't see a reason why a patient. Everybody has a smartphone these days. They are very cheap, and data is free in India practically. So I see a situation where a person has been given a authorized app, mobile app, by the particular hospital, and maybe Wockhardt's lifeline in a pocket. Maybe could be an app like that, and he has that, and he has been issued certain variables, and his entire thing is getting monitored remotely. That data is coming to his assigned clinician's desk. All trend charts are happening. So systems will become so wise in next 3 to 5 years. If a person is going to get a heart attack soon, there will be alert from the system which will be sent to his and his next to kin's mobile. He was get your dad here right now. He's approaching that red line. If technology can do, and it is possible to be done, there's so many IoTs, so much of data, that what happens 15 minutes before actual attack, what happens 3 days before attack, all these clinical histories are available in abundance. If this can be put into meaningful logic and algorithms, a lifeline in a pocket kind of an innovation for Wockhardt in this health industry. Correct. So 3 to 5 years, it's going to be a happening time for both of us and the IT team over here, because there's so many things that are going to change, and change for good. Innovation which makes a large impact has to be complex and complicated. Whatever is affordable, simple, and easily deployable, that kind of a technology, if you deliver, it will always sustain and make a long lasting impact. That is how it is.
I mean, my thinking is that technology should be like you turn the tap, water should come. You put the light, switch on, the light should be on. You should not be worried about it. Will it or will it not?
Yeah.
It should not be cumbersome. It should be easy. And that's how it should be. That's why I said it should be invisible in the background. Yeah. I expect it to work to get my job done. Okay, if the light is not working, it won't happen. If the technology is not there, in the healthcare space, it will not work. Okay. And then, you know what? 5 times the patient will repeat the same thing and they'll be waiting. That's how I think it. You have far elaborate.
I think both of you put it really wonderfully about why technology and how technology should actually work in a healthcare setting or in any setting. I think it has to serve the people, not the other way around. The people do not have to, sort of struggle to figure out how this technology works. Well, with that, we have come to the end of this episode. I mean, for me personally, it was not a podcast. It was like a crash course, a mini crash course of healthcare technology leadership, like a mini MBA I got right here at Wockhardt Hospital with both of you. So thank you so much for being part of this podcast, being so dynamic, sporty, and open to all these questions and open with all your inputs. Thank you so much. I think all of our viewers, all the next gen healthcare IT leaders who are watching this podcast episode will take away great learnings from this.
And thank you.
Thank you.
Thank you,
Thank you.
DHN, for having us also.